Hi, today we're going to go over cardioversion in a patient. For the purposes of this video, the patient has rapid AFib, an abnormal fast rhythm that we're going to hope to cardiovert into a normal sinus rhythm. Before we can do that, we want to make sure that the patient has been taking their anticoagulants to prevent the risk of a thromboembolic event. We want to make sure this patient has been NPO because they will be sedated. We want to make sure that they have IV access for sedation and also emergency interventions. We like to sedate our patients with propofol because it works rapidly and it loses its effect very quickly after the procedure. We also like our patients to be shaved to increase the conduction between the paddles, the chest, and the atria. So the goal is to convert this patient to a normal sinus rhythm, a rhythm that's coordinated and steady. And according to the International Committee on Resuscitation, first thing we do when we cardiovert a patient is place the paddles or the electrodes onto their chest, to the right below the clavicle, to the right of the sternum, and then below the axilla, below our armpit, mid-axillary line. We can also put them in the front and back. However, that's less recommended because there's better conduction when both electrodes are placed on the chest. I'm going to turn my Zoll on. Another thing that I forgot to mention, we also want to have regular electrodes on the patient because we want to monitor their heart rhythm at all times, along with vital signs as well. So I'm going to turn the Zoll on. And as we mentioned, our patient comes in with AFib. So this patient has AFib, rapid AFib. I'm going to put our Zoll into a manual mode. And it's very important that we have the synchronized option on because we want to make sure we deliver the shock at a certain point on the QRS complex and not at a vulnerable point where it can cause another dangerous rhythm such as VFib. Okay, so as you can see, our QRSs are being synchronized, and then we are going to select the energy level, and this really depends on your hospital policy. For this video, we're going to do 150 joules usually. We start at 100, between 100 and 200, and if that doesn't work, we go higher. Now I'm going to charge, and I'm going to ask everybody to stand clear, stand off patient as I deliver the shock. And after the shock is delivered, hopefully this patient will go back into a normal sinus rhythm like they did here. And that is how you deliver a cardioversion. Thank you.